It works. She always laughs at me. This is the time in every meeting where about 3 minutes before it starts, it goes dead silent.
Dead silent, yep. Take off time
Yes.
when you say your prayers. All right, I'd like to call our July 16th, 2025 Board of Health meeting to order. First thing on the agenda would be the approval of the agenda.
There are no additions or corrections. I move they be accepted as submitted.
All those in favor? Aye. Aye. Any opposed? Agenda is approved. Approval of our minutes from May 21st of 2025.
I move we approve the minutes.
All those in favor, say aye.
Aye.
Opposed? All right, our minutes are approved. We'll move on to reports for the Board of Health, and we have Dr. Chernin on tap first.
Oh, okay. It's good to be here once again. Sorry about that. I'm here if you have any questions. I know Dr. Tripp was interested in COVID, a little bit of what's going on with that. I can fill you in a little bit with that. And whatever else you want to ask me, I'm here to answer questions. So a little bit about COVID. There's a new strain out right now. It's called NB.1.8.1. These are just numbers. And so you can put that in your brain and not do much with it. It's a variant of the most recent one, which was LP.8.1. These are all part of the Omicron variants. The original one, which caused all the deaths, 25,000 deaths a month, originally in 2000, 2001. I think that was the most severe one. Then the Omicron hit, Delta, then Omicron. And so we're still in the Omicron variant. So there's been what we call an antigenic drift rather than an antigenic shift. When you have a very different strain, then it's called a shift. But this is more of a drift, moving differently. So if some of the particles of the virus are actually changing, but not changing dramatically. So the vaccines that we have out right now still should work because they're all towards Omicron. Only about 23% of adults are getting the vaccine right now, and maybe 13% of kids are getting the vaccine. So there's a lot of reasons for that. I think we have COVID weariness. I think we're kind of don't want to get vaccine because we still see people getting COVID. And we didn't know that in the beginning and whether people would get COVID after they've had the vaccine. Like measles, people don't get measles generally if they've had the vaccine or have had the disease. But because of the vector situation where COVID is really a disease that's passed from animals to humans, it's very difficult to get a complete immunity to it because there's variations that go through the animal to the person's. Measles or polio don't have an animal vector. Anytime you have an animal vector, you're going to have more difficulty with having a vaccine that's going to work permanently. But it does work. It works to help people from getting very sick. It helps people from dying. And that's what we found over the years. It took a long time for us to really understand this. So we're in that phase right now. Is it a serious disease? Yes, it is a serious disease. I think in the month of June, we had about 550 deaths from COVID, which is significant. If you multiply that by 50, then 52 weeks, you're going to get, still you're going to get, 25,000 deaths or so a year, which is a lot. A lot of people die, not like, the hundreds and hundreds of thousands we were getting, early parts of COVID. And part of the reason I think people aren't dying is not that the virus has changed that much, but as people have an immunity. And how do we get immunity? We get immunity through having the disease, gets partial immunity, but not complete, like I just mentioned. And you get immunity through the vaccines. So about 98% of the population of this country have had some immune protection, either through the vaccine or from having the disease. So it's not to be taken lightly. I still think that we need to be careful and thoughtful. I think we should still, in my opinion, we should still promote vaccines. People who are, especially people who are vulnerable. Now, you've probably heard in the news, I'm sure you're all aware of that, the new administration with Robert Kennedy Jr. Kind of being sort of a vaccine skeptic to some extent. He's not against vaccines completely, from what I understand. I don't know the gentleman, but he certainly hasn't been promoting. They wanted to make it so that the vaccines were only used for people who were over 65 or people who were vulnerable, had immunocompromised diseases, and to eliminate it in every other population. But that hasn't gone so well over, the major people who, follow this, and the vaccinologists, immunologists, and people who are in public health feel that women in particular who are pregnant are 4 times as likely to get the disease seriously and or die. So we're really working towards making this more clear. Right now, it's not so clear. It's a little muddy. We're pretty sure that people who are in the vulnerable positions because of immunosuppressant and older people who, what it's called immunosenescence, where the person who is older doesn't have quite the immune response that a younger person would have. So we're encouraging people in those categories to get the vaccine. So that's a little bit about the vaccines. Still, the treatment for COVID is still the same, Paxlovid, 3 tablets twice a day for 5 days. It does seem to decrease the intensity of the disease. People who are very sick or, like I say, immunocompromised, it does seem to help. Unfortunately, because it's a suppressant of the virus, doesn't kill the virus, people who takes Paxlovid sometimes will get a resurgence of the virus after that. Seems that people get better and then the virus seems to come back. So that's one problem we have with it. Sometimes people don't like the taste of it. It's a pretty safe drug, but the taste is pretty nasty. But I still recommend it for people. In my private practice, I do recommend it for people who are in a vulnerable population, or if they want it. And I think it's a reasonable thing to give it to people who really want it. And it does, as I said, it does help protect. So what we're seeing right now in COVID is we don't really know the numbers of people who have COVID because number one, people aren't tested anymore. They're just, oh, okay, well, if I have COVID, so what? Sometimes people are not going to the doctors when they have COVID because it's milder diseases. And sometimes people are just, the doctors aren't reporting it, or the health departments aren't reporting it because it's not a requirement anymore. So we really don't know the true numbers of COVID per se in the population in this country. But as I said, we do know how many people are dying generally with it or of it. And that's about 500, anywhere between 350 and 500 a week. How do we know COVID is still out there? We're basically, doing wastewater testing. Some countries are still doing wastewater where they find the virus in the wastewater. And that's how we know there's a resurgence. It's pretty quiet right now, which is good. Summers tend to be a better time. Winters tend to be not as good of a time. It doesn't follow the same trajectory as influenza, which is pretty much a disease in November through March, maybe October to March. COVID doesn't follow the seasonal variation that you see with the flu. It can be all year long, but right now we're seem to be pretty quiet with COVID if you look at the numbers. But as I said, people are still dying, so serious disease. We are hoping that there won't be a very antigenic shift where the virus changes dramatically and the vaccines no longer work and our immunity is not so good. to the new virus. So we're kind of, people are watching for it. It's not gone. Is it still a pandemic? Technically, we still are in a pandemic, but realistically, we're not. It's more endemic right now. But you can't call it. You can't say it's not a pandemic because it's still worldwide and still happening. So I'm open to questions or any interest in some other aspects of COVID. I'm glad to talk about it. And anything else you want to sort of grill the medical director?
Just a personal sidelight. When I was in Europe, I got the new variant.
No kidding. Wow.
Yeah, and the headache was incredibly terrible. Luckily, my doctor sent me to Europe with Paxlovid so I could treat myself.
Wow.
So I self-isolated where I was for 5 days,
Mhm.
and then I tested negative. So I was like, okay, I can go home now.
Wow. So, yeah, and you tested for positive for COVID
Twice.
twice. That's amazing. Yeah. The isolation and quarantine and we don't quarantine anymore, but isolation is what you did is reasonable. Um, the new CDC guidelines suggest that if you're like with flu or any other disease, if you're 24 hours fever free and you feel better, you can start circulating, but you still should wear a mask if you're circulating. I was interested. I was in Japan in April, and people in Japan wear masks all the time. Not everybody, but it's kind of a community thing where people sort of want to protect other people. It's what I call a communitarian value, where people give up a little of their rights to serve other people. And the United States had a difficult time with that because we kind of are somewhere between libertarian and communitarian, which libertarian means I'll do what I want, don't tell me what to do. Communitarian says I'll give up some of my rights to help other people, which is public health, by the way. And so I think in the Japanese and the Asian cultures, there's a little more feeling of, oh, we need to protect other people. Even if they're not sick, they wear masks. Anyway, so that was interesting just to be amongst the population of Japan, where in the United States, you see maybe 1 out of 100 people wearing masks. I actually still wear a mask on an airplane. I don't know about you guys, but it's maybe 10 of us or 8 of us are in a big plane of 250 people and wearing a mask, but I don't want to get stuck sitting next to somebody that has COVID. So that's why I wear a mask, and also to protect the people if I'm not feeling well. But I don't really fly if I'm not feeling well. But it's actually mostly self-protection. And it's up to the individual. I don't think it's certainly not mandatory, and it's a decision. I was at a play not too long ago in Saugatuck, and I was sitting next to somebody who was kind of blowing their nose and stuff. And I just said, I had a mask in my pocket and pull it on, put it on. So, yeah, so you're all okay. You're okay. And that's good. That's good to hear. Yeah. Yeah. So as you can see, it's still around.
Yep, it's definitely there.
Yeah.
The people in Europe do wear masks, though.
They were wearing masks.
There were a lot of people wearing masks in Europe.
Interesting. Where were you?
Sweden, Finland, Norway, and Germany.
Oh, Scandinavia more.
Mhm.
Yeah. I love Norway. It's a
Yes.
beautiful country. They're all nice.
Yep.
Yeah. So that's interesting. My daughter was in Spain and I visited her a couple times. She's back in the States now, but no one wore masks in Spain. It was quite interesting. I didn't see one mask in there. And the other thing, I felt that there was a lot of smoking and stuff like that, which I thought was kind of interesting. United States, we don't, people don't smoke in communities anymore. It's something that's really changed, which is a good thing, obviously. But in Spain, the people are smoking all over the place, restaurants next to you, and didn't think much about it. So I thought that was kind of interesting. Different people's cultures are really different. It's good to hear there's some people wearing masks in Europe. Yeah.
So,
And in Sweden, they never locked down.
Nope.
And it was interesting if you compare Norway to Sweden, which are similar people, Scandinavian and sort of similar folks. The death rate and the rate of COVID was 4 times higher in Sweden. as it was in Norway, and Sweden locked down, and Norway locked down, Sweden didn't. So when we look back retrospectively, did we do the right thing? Did we, as a lockdown and closing our schools and everything? I think we did. And I think it was a good experiment between Sweden and Norway, where the Swedes decided not to do anything, except for maybe their nursing homes, but and they had much higher rates. So did we need to lock down our schools and call off school for a year? Retrospectively, I'm a little less sure of that, but we had to protect the adults. Because the kids haven't gotten COVID like we were worried about. And so that's why it's not as kids aren't getting into the shots. And I think that I still think we did the right thing. It's easy to look back and say, should we have done that? Should we have done this? Because there was a lot of teachers there. There were vulnerable kids there. The strain was really bad. It was a novel virus, so people were getting sick and dying. I had several patients die from COVID early on. And so I think we did the right thing. The janitors, the teachers, the administrators, they were all vulnerable. So I think probably it was the right thing to do. It felt bad. I mean, the health departments that I've worked with in Lenawee County in particular, we struggled. There's a lot of backlash against it, but ultimately, I think we did the best we could, and we did a good job. Yeah.
I found it interesting. Recently, I was at a health facility in another town for someone I took in, and nobody in that facility, staff, nobody was wearing masks.
Yeah.
Now, I use VA. I go to the VA hospital, to VA clinic locally. While they don't require it, they have masks everywhere, and they strongly recommend that you wear a mask.
Yeah. Well, that's very interesting. Yeah, I think it really depends on where you are, whether it's rural or city. I think there's still a difference. Some areas are more sensitive to the issue of masks. So I think that's an interesting observation. Yeah.
Dr. Trinan is always available, so if anybody ever has any questions or needs to speak with him, just reach out to me and I can connect you with him. So just to remind everybody of that. So
it's one of the things I do. I'm 24/7 on.
Yep. So thank you for being here, Dr. Trinan.
Thank you, Monica.
Thank you much.
Thank you.
Thank you.
All right, we'll move on to the review of the accounts payable reports, and we do have 2 months of goodies to review. So we'll start out with our May report.
I'm ready whenever you are.
Okay, I don't think I had too many questions on that one. On our third page for the recycling service, is there some time missing there?
Actually, that's a good catch. There was an issue for this particular contract. LRS raised their prices for standard, like pickup and delivery and recycling. However, we have a contract with them it's a 3-year contract. So the bill had come with the updated pricing, so we had to go back and forth for several months to get everything correctly billed to us. So we think at this point we're on track.
Okay. And then on the next page, under Seabird Products, the DOS equipment repair.
I'm going to have to defer this to Casey because I don't recall what was broken on the DOS.
So we have had to have, maintenance has had Seabright come out a couple times now because we are having a lot of issues with our cardboard, in particular compactors.
Yeah, it's usually closed.
I think it's number 3. I think the cardboard is 3 and 4 out there. So they did have to come out once. I'm not sure which one this is for. They thought they had it fixed and then it wasn't fixed. So they had to come back out again. So I think the one they fixed is doing okay. And now the other one is kind of starting to have issues. So you're right, it was recently closed. That wasn't because of the compactors. That was because both cardboards were full. We attempted to leave it open for people to do plastics and they were not very respectful
Responsive.
of the rules. So we ended up having to close it. So yeah, but yes, that's what that is for repairs.
Okay. And then on the final page, the time clock plus.
Okay, as I'll locate it in a minute, but, so clock plus during one of our, audits, it was noted that, we do everything by paper still,
Mhm.
because we have so many different grants and cost centers that we have to code to. People work in a variety ranging from 3 to 11 different cost centers that they work through. We don't have the ability in the county's system to be able to run any type of report that breaks down by hours what we have done. So right now, we have to manually calculate anything that we have done by taking the paper reports and doing that. The auditors deemed that this was not a good process. And we were told that we needed to implement something more electronic. So this was recommended by multiple health departments throughout the state. And surprisingly, it was very reasonable. So we are in the process of getting this software up and running through the health department. And there is a component that will actually speak with the county's program to be able to upload it directly instead of having to manually enter everything. So it's actually a pretty intuitive program.
So when you're working on a grant, you log into something
Yeah.
and go to another one, you log into something
Yeah.
else.
Yeah,
Okay.
there's a way to be able to do it through a computer, a tablet, a phone. We can have it automated so that when we hit our badge, we can switch and change what program we're in. There's a lot of different ways to utilize it. It's actually pretty cool.
Okay. Any other questions for the May accounts payable?
No.
All right, I'll look for a motion to approve the May 2025 accounts payable report.
I move we approve the May 2025 accounts payable report.
All those in favor?
Aye.
All right, we'll move on to the June report. On our first page, under the first bank card, can you tell us what those conferences were for?
The Amway Grand Hotel, the EPC, it was the last conference that our emergency preparedness coordinator went on, prior to leaving the health department. But it was an all-state conference for emergency preparedness. The one right below it, the Delta Hotels, that was the Michigan Recycling Coalition Conference, and that was for our solid waste and materials management coordinator. And I think those are the only conferences on there. The one right below Delta Hotels, they had charged us tax, so we had to get it removed. We do have some NEHA memberships, and that's for our sanitarians. And then we had a dumpster rental for our office furniture. We had a lot to get rid of.
That's all I had for questions on the June report. Any other questions? All right, so I'll look for a motion to approve the accounts payable report for June of 25. All right, all those in favor?
Aye.
All right, accounts payable are all done.
Thank you.
Thank you. And we'll move on to our health officer's report.
Okay, good afternoon. The respiratory illness, COVID, RSV, and influenza is low throughout the state and in Lenawee County. Avian influenza activity is low as well. There has been no detection in over 30 days. As of current, there is 18 cases of measles in Michigan. There is none in Lenawee County. We had accreditation the last week of May, and that went very well. It was a long, short week because it was Memorial Day week, but it was a success, and those reports should be filing in here shortly, and they will come to the Board of Commissioners, and we'll also get this board a copy of that. Strategic planning is been ongoing as well. The survey went out to the board and to our staff. We had a leadership meeting and then an all-staff meeting last week. That seemed to go pretty well, and they were interactive and engaged. Another survey will be going out to have them assess their criterias that they selected and things like that. And then by the end of August, we should have a draft plan. This will be a 5-year plan, so we're looking forward to seeing the draft. The CDC infrastructure grant, the RFP for the projects did go out. And we had our public bid opening on June 20th. So those are gonna be finalized in front of the Physical Resources Committee next month, and then in front of the Board of Commissioners for final approval. Just a few legislative updates. Of course, there's some federal things happening as today, and there's, the bill that was passed already, but just a couple things on the Michigan side. There's Bill 4577. It's a school aid budget reallocation. So this bill is looking to shift how hearing and vision and oral health allocations are distributed. So they are looking to roll that allocation into the per pupil allocation for the schools and remove it from the health departments. And so really what happens is the school aid fund houses that fund, and then they give it to MDHHS, and then MDHHS distributes it to the health departments. And so this bill is looking to eliminate that and give it to the school districts as a per pupil increase. So that is something that we're definitely watching. That could be a big impact. The hearing and vision is statutory, so we will still be required to conduct hearing and vision screenings. How that looks could be interesting. If this bill does pass, we could negotiate a contract with the schools. If the schools so choose to make that a priority, or we would still have the service at the health department and not go to the schools, so there's a lot of different variations that could happen. But I just wanted to bring that to your attention, that is, it's a House bill that's being looked at right now. And also there is on the federal level, a new federal interpretation of personal responsibility and work opportunity reconciliation. This rescinds the 1998 guidance and restricts federal funds to only U.S. citizens. So essentially what this means is that any program that receives federal funds, we are only able to service U.S. citizens. So there is a potential to impact multiple clinics and individuals that we service in our clinics. Couple things that we do know, MDHHS, I was on a meeting with them, and they have advised us that we should be prepared for delays in federal funds, that there may be additional stop work orders if they do not receive a notice of awards. And the reason for this is that not all of our grants start on October 1. So historically, we all believe that it started on October 1 because we have one grant, one contract. But we have multiple grants throughout the year that start at different times, and they've just kind of filled the gap for us. And we just have one contract, making it easier for all health departments. With the uncertainties of funding, they have now stopped that, and they are looking at month to month of all the contracts that are going to be renewing and waiting to see if, their allocations before they renew it for us and for them. So we could be seeing some more delays. We did receive the notice of the stop work order for breast and cervical. A week and a half later, we did receive notice to start again because they received it. Last week or the week before, we received a stop work order for immunization program, assurance program, IAP. The next day, it was rescinded. So there's going to be multiple situations of this because there is delay at the federal level. So we're working as, you know, as best we can, and we're going to do what we can with, you know, we're going to continue to serve the community, and until we have it in writing, we're going to just do as business as normal. We did receive verbal notification that there's going to be a 30% funding reduction in emergency preparedness. We have yet to see that in writing. So we're just business as normal, and we're going to continue to do our best and respond accordingly. So if there's any questions, I'll be happy to answer them.
Referring back to this House Bill 4577.
Yeah.
You said it's mandatory and the funds are going directly to the school if passed.
That's a House bill, correct?
Yeah, it's Michigan House Bill 4577. Yes.
And if the money will be going directly to schools, who is the mandate on the health department to perform the services or on the school?
So it's in the public health code that hearing and vision screenings take place. So it is mandated by the public health code.
Is there anything in the bill that mandates that the school system pay the health department to compensate?
There is not.
Pardon my comment, but the current Michigan House is somewhat following the federal guidelines.
So we're keeping an eye on it, and there's a lot of people are reaching out to, you know, the legislation, and, you know, and it's not only the hearing and vision and oral health, it is the health centers in the schools as well that are at risk. So there's a big school aid situation that there's some tension there, so. And the Michigan budget has not been passed. It should have been passed on July 1, and it's still outstanding, so there's more to come on that.
Are they working on the septic code?
That is to be reintroduced, and through my deep dive search, I have not seen that come across yet.
Okay.
And could you just give us a quick update on the two public presentations we had for environmental health?
Both, you want to go? Okay.
I was going to talk about them in my report, but I can do it now if you want. You can wait? Okay.
All right. I don't see any existing or new business. So we'll move on to program reports. Personal health first.
So as Monica said, every day is a new challenge, but we all made it through COVID, so this isn't not anything to us, is it, Dr. Chernin? On a positive note, as Monica said, we went through accreditation. All of my programs got exceptional reviews, and we did really well. It was my first time as the director going through it, and it was the first time for a lot of my staff, so I was really pleased with that. So one thing that I will be in the report, but Monica met with Laura, who is the director for MDHHS, and she was very impressed with our social determinants of health. If you remember, we implemented a screening process for our clients to determine food insecurities, medication insecurities, travel, and I believe we received 26,000. And then we just got reported that they gave us another $10,000 for nutrition to be able to support the community with that. So just this last quarter, for instance, we handed out 136 coupons for the Veggie Mobile. So we'll be able to partner with other local entities. We're going to try to find different entities besides the Veggie Mobile, as far as like grocery stores or the local markets or somewhere to expand it through the winter and everything. So that was great news that we got that $10,000. Clinics are up and down. Our nurse practitioner is going on maternity leave in a couple of weeks. So other than that, I think we're just keeping our heads up and doing what we can do. Any questions for me? Thank you.
All right, we'll move on to environmental health.
All right. Hello, everybody. So as I said, I will provide an update on the two gentlemen who were here at our last meeting. First is the Alamo Court property, which just as a reminder was the gentleman who had some concerns about his existing well and potentially using that, and then the process for permitting his septic system with soils that were unsuitable. It was Mr. McCrate. He did go through the process of getting his well evaluated by a licensed well driller. He submitted a report to us. He was able to obtain a clean, safe sample off the well, so we gave him the go-ahead to move forward with using that. And then he did go through the rest of the process as far as getting an engineer to submit an engineer drawing as per our unsuitable soils policy. And he got all of his plans approved. So he came in and got his permit for that. So he should be, as far as I know, well on his way to being able to build his house. Because once they get that from us, they should be able to get building permits. So I have not heard anything from him. So I assume we're all good to go.
Okay.
The other gentleman who was here, Mr. Hoagland, he was the one out on Robb Highway who had made a formal appeal to the board about being able to use a hauled water supply for his brand new home. He also went through the process. He submitted all his plans and I actually signed off on the approval this morning. So I don't know if they've been in yet to actually pick up his permit for his septic system, but I do know the hauled water has been put through the process. It has been approved. So he should be able to move forward with that as well. So both of those seem to have been resolved.
Good.
Thank you.
Yep. I didn't have any update on the statewide septic code. I also checked today. I do know that they're still saying that they have sponsors, that they are going to eventually get reintroduced. I have no idea what that will look like when they will do it. They have until the end of next year to do that. So, when I know more, I will let you know, but it's just, that it's somewhere floating around in the background at this point. As far as your reports go, I don't have anything major to report there. Based on our June report, it does look like we've picked back up in our permits. We've been kind of down up till this point in the year, so that's a good sign. We've definitely had some days at the health department where we've had like 5 people at the counter all wanting to put in permits of some kind or applications for permits. So that's been good to see. Our staff have definitely been very busy these last few weeks. I don't have anything major to report as far as food service goes. I think I reported last time there's no faster horses this year, so we have not had to do all the prep that we normally do for that, which I can't say my staff is sad to not have to go out and do that this year. So it takes a lot of time and effort, and it's a long day. So the only other couple things I had is we've already had a few harmful algal blooms reported this year. We had one that was on Devil's Lake that we did put out a news release on. So it's just something we've tried to do a lot more education on. It's pretty early in the year. I don't know if it's just given the hotter weather, the intermittent rain. It's kind of hard to say. I will not be surprised if we have more as we get later into the summer. Typically, we see them more mid-August into September. So just something we're keeping an eye on. And we'll continue to put out releases just to let the public know to stay away from them, especially keep their dogs out of them because it can be very deadly to dogs. You probably know that, Dr. Tritt. So just continue to keep an eye out and do messaging on that. And same thing, like Natalie had said, accreditation. We went through accreditation for our food service and our on-site wastewater, and we got glowing remarks from both of them on our exit interviews. So I expect that the reports will reflect that as well.
Okay, thank you.
Mhm.
Anything to report on emergency preparedness, Monica?
I submitted a bunch of reports and that were due for our year end, and I did do a staff assembly. That was a requirement of one of the year ends, and I did receive the BP2, which is year 2 work plan. So I'll be moving along with those requirements in the coming months.
Yeah. All right, thank you. All right, we're on to finance.
Hello again. All right. Our third quarter ended on June 30th. I will have the third quarter FSRs in your packets for next month's meeting. There were no changes to report for the vaccine prices for this quarter. I anticipate any price changes will occur before our next flu season in October. The state did release our preliminary allocations for next year at the beginning of last month, and they were at level funding for what we've gotten for this year. The budgets for the states were due this past Monday, and the county budgets are due at the end of this month. I also finally received the contracts for the increase in the infrastructure funding, as well as the $74,000 bridge funding that I spoke about at our May meeting. So we should be seeing the actual funds in our accounts here within the next few weeks. And that's really all I have at this time. Are there any questions?
All right, thank you.
Thank you.
We'll move on to public comment if there is any.
Strange. Remember the days when it was a full room out there?
Yeah, there were those days.
I have a question. I've missed it somewhere, I think. Do we still have the children make placemats and do the billboard for smoking and?
The Love Your Lungs. So we did do that last year or the year before. So the schools would do that and they changed the criteria for teaching that. So they've kind of reduced us being involved in that because of the criterias.
I woke up one night thinking, we haven't discussed that billboard and the ad in the movies and the little placemats that the kids made and what's happening. Did I miss that?
Yeah, it was a very nice program. The criterias for teaching that has changed quite a bit, and the school has some requirements for modules to download, and so there's a lot of changes involved there.
Okay, I understand. Any rate, I missed it. And I'm glad I didn't just miss it, that kind of thing.
Hey, do you have any updates for us, Kim? All's quiet in the county? Sort of?
All is wonderful in the county. Yes.
Okay. All right, we are to the need for adjournment.
So moved.
All those in favor?
Aye.
All right.